Dr. Jeannette Young, thank you very much for your participation to our panel discussion tonight, the launch of the Institute for Molecular Bioscience Centre for Superbug Solutions. What's the take-home message for our attendees tonight?
The most important thing is that we've got a whole lot of strategies and we need to use all of them to meet the threat that antimicrobial resistance is coming and heading towards us. So first we've got to prevent infections. So that's by good hygiene in hospitals, good hygiene generally in the community, preventing disease by using vaccinations where we have vaccines for particular infections. Then when people become unwell, we need to, as rapidly as possible, work out what the cause of that infection is so that we don't misuse antimicrobials, so that we use antibiotics for bacterial infections, that we use antivirals for viral infections. So the work that's been done at the IMB is critical in finding methods of working out what infection someone has as quickly as possible so we can target the best treatment. Then we do need to educate the broader community about when it's appropriate to use antibiotics, that we need to reserve them for when they're needed so that people don't use them if they've got a viral infection, because they won't work, they'll cause side effects, they'll cause problems, and also in the long term they'll mean that more resistance develops and we won't be able to use those particular drugs in the future. So there's a whole range of strategies that we need to bring together and work through. Australia has signed up to the World Health Organization initiative that has asked every single country to develop a plan to combat antimicrobial resistance. We've developed a plan as a nation which has widespread support across government, across the various parts of the health and the veterinary and the agricultural sector. Now we need to implement that plan. So we've got a workshop coming up that will bring all the different stakeholders together to work out what we can do, what we can achieve and what we need to progress. But here the most important thing we've got to do is that everyone in the community, in the health profession, in agriculture, in the veterinary profession needs to understand the key role that drugs play in meeting that threat of bacterial infections and different other infections.